before I begin, I just wanted to go back a bit and to break down the concept or the word AI. I think it can get very complex, but if we go back to 1956, a couple of very smart people, they came together into a workshop which was called the Dartmouth Conference and Summer Workshop. And the intent was, if they could come together from different practices and they could break down what intelligence is, and if they could get that down to formulas and calculus, maybe they could get machines to do things that required human intelligence to do so. So they spent a long time trying to break this down and see what, how, intelligence is perceived. But of course, and we see it now, intelligence is elusive. We don't know what intelligence is. We know what intelligence looks like. We know what are the outcomes of being, intelligence, which is the ability to learn, the ability to make decisions, the ability to understand and adapt to whatever situation you are in. Walk a few years back now. We are in a world where AI for the past 6 years has been one of the most searched terms in the internet. It is both a swear word, it is a slang, and it is a technical term, so we get to move around with the term. And today our focus and Census Air focus is to talk a bit about what happens when the air becomes data. And I think that even though we came from different backgrounds, I was born in Rio, Brazil, and even though we have different upbringings, one thing we have in common is this room and the air that we are breathing right now. And wanting or not, the air is influencing the way you feel, the way you think, the way you behave, the way, of how tired you feel and how you recover. And that's what we're going to talk today. And as I mentioned before, I was born in Rio, and when I was born, and I don't want to reveal my age too soon, the soccer was at the pinnacle of what we understand as actual Brazilian soccer. So everyone wanted to be a soccer player. They wanted to be the next Pelé, the next Zico, but I had a great affinity for Lord Kelvin, and I wanted to be like him, and that made me the weird kid. But I'm telling you this to get into the construct in which Census Air was founded upon. Lord Kelvin, which we probably know as the Kelvin metric, the Kelvin scale, which is the actual discovery at, the actual absolute zero and a point when things stop moving. And he was always fascinated and obsessed about measurement. And, one of the paraphrases is that to measure is to know. And that obsession for measuring is what fascinated me. And if we look back into history, we can realize that the greatest revolutions begin when we find ways to measure what was once invisible. That happened with gravity, that happened with many of our actual discoveries in space. And now we are in a situation where the air we breathe is something that it is part of our lives, and yet we don't have the measurements that we need. Now, let me scroll down again. Just a quick on a bit of my background, but I wanted to focus on two things, which is I am a husband and a father of 4, so I am deeply concerned about the air that we breathe and about how we interface with the future. And I want to ask you a question. In fact, I'm going to ask you a question because you're close by. If you were thirsty after a long day of work or after working out or whatever, if I presented you with these 2 glasses of water, which one would you pick?
The clean one.
And which one is the clean one? And why do you say that this is the clean one?
Because it looks clean.
Because you can see it. And because you can see it, as an intelligent being, you respond to that because that's an element of intelligence. Now, what if I told you that this water is actually lethal? How would you respond to that? Terrified, right? But now I'm fighting with this thing here, which comes to the point where the invisible isn't harmless. Even if we don't think of it, even if we don't remedy, it doesn't make it less harmful. So right now, in everything that we do and every single day, we are under the influence of the air that we breathe. Going back to the next slide, there we go. And the air, you know, if you walk back into the built-in environment and into the healthcare, I mean, we've been very privileged to be in many different hospitals and also studies. And we can see that the quality of the air is both coined as the invisible threat and the silent burden. You can see how it is at the very heart of how people recover. It is at the very heart of actual infection prevention. Like the indoor air pollution is linked to an estimate of 3.2 premature deaths annually worldwide. The outdoor, the data was public yesterday, 7.9 million for the year of 2023. In hospitals, it has been proven of actual studies that the indoor limits have been exceeded by at least 3 times what the WHO limits predict. People spend 8 to 90% of their time indoor. I mean, wanting or not, we are indoor creatures. You know, we can go outside and see around, but we go back home. So the quality of our air is governing the way that we live. Oftentimes, we think that the way we behave, maybe in like schools, maybe in hospitals, the way that we behave can be seen as a behavioral issue. But in reality, it is a chemistry issue. It is the air that you're breathing that is influencing the way that you interact with the world. You know, we got some data that contaminated indoor air increases post-operative infection risk, and that we can see over and over in our studies. Let me go for my walk again. So when the air is ignored, risk multiplies. We have released a few papers, and we can see that pollutants in a healthcare system is up 5 times higher than it is outdoors. We know that a 19% infection risk, it is higher. We can see that the poor air quality delays recovery. There is a direct correlation of how PM10 travels through the wards and how they impact the actual recovery, and also association with the medicine itself. But what happens when the air becomes data? What happens when you can see or when you can measure what you couldn't once see? What would happen if you could have a real-time analysis of what you were breathing in? We had the benefit of tracking this whole conference. That's why those QR codes are there. We had monitors checking the quality of the air that we breathe in. How would that be for you if you could have a full visibility of your air at home, at your school, but most importantly, in the healthcare systems? What if you could turn observation into prevention? What if you could forecast? What if you could predict risk before they happened? What if we could transform the way that we handle medical care using air as one of our medicines? The evidence you can see. Going back to a bit of my experience, and in my career, I was in banking, and I was a software developer that was in charge of fraud modeling and risk modeling. So for my entire existence, as I remember, I've been trying to write models to predict patterns that would infer or they would predict fraudulent behavior. If we can do that with money, why can't we do that with the air we breathe? Why can't we do this with the very thing that changes everything? The air ledger. A ledger is a book of collections of accounts, which accounting transactions are actually recorded. So in the ledger, you have credits and you have debits. What if we understood the air and our interaction with a room as transactions? What if every inhale and exhale would be a credit and a debit into the balance of the room that we all share? Transactions to breaths, like balance sheets to baselines. How do we move? How can we get the financial rigor into our actual environment aspects of our actual environments? Again, I'm just going through it so I can keep you guys engaged, but how can we go from random readings to structured records that tell you a story? How can we gather enough information of our air where we can predict fraud, where we can model risks, and we can prevent something before it happens. One thing that we know and that we've learned is that although we love precision, we know that sometimes precision is too late. You want to identify the pattern and cull the pattern and respond to that pattern before it evolves into a risk that now you have to mitigate. As the adage says, prevention is better than, that's correct. Sensors there, and that's where we come in. We've packed our financial ledger construct, experience, and rigor, and we created a ledger for air that allows us to understand and to build context into air and to give a deeper understanding of what are the risks, what are the pattern breakers, what are the variables into the air soon enough so that you can identify and respond to it. So what we've done, we have built devices that tell a story. Often, people say, but there's so many devices out there. Why are you building a different device? We put our efforts together to build continuous monitoring that gives us enough data metrics to put into our pool of labeled data that we can understand and classify any room against millions and perhaps billions of rooms of the same type, so that we can identify what are the expected behaviors and what are the outliers that could be influencing a room. We have reliable and AI-driven instruments. We went to the extra length to handpick each component out of that unit. But most important, it's a pattern recognition for risk profiling that sets us apart. And that's how we use that intelligence that John McCarthy and Claude discussed in 1956 of how to get the ability of intelligence, that learning ability, that recognition ability backed by a super memory. If we put enough context to that, how fast can they identify, how fast can they place or recognize and profile risk? So that's one of the most important element. And of course, the outlier detection. We've got some screens that I want to show you of how we have that in action. But over the past years, we have 4.1 trillion environmental fingerprints maintained. And what that means is we've exposed our units to different environments, to different tests, to different labs. And we are trying to gather these different pictures. I mean, most of us would understand or even remember that the first explanation of AI was, is this a cat? Yes or no? And you'd put different images of cats, and then we'd put a cat. Is this a cat or no? So there was this identification by memory. So we have exposed our units to different fingerprints and to different environments, and we collected clinical observations and we labeled them, and we've trained them and we maintained them. And now we have a 98.7 data integrity rate, and we trusted across 4 continents, and we are starting in South Africa, which we're very excited about because this is home. We built it here, but we felt that our market wasn't ready for that level of observation as yet. So AI at work. So what does that mean? I mean, how can sensors display their data? So we've built a few different reports that, again, can be accessed via apps, via dashboards, and it's easy to understand. Again, you can drill down as you go. Through those barcodes, you'll be able to see if you want in real time on your app. But we have different trend analyzers, so you can see over time. You can layer times and see how the core metrics behave. Maybe you are implementing a mitigation system and you want to see how that influences the metric over time. So you have that. We have your actual environment DNA. Like I mentioned before, you are matching your data against all buildings of the same type and of the same profile. And then you see what is the heartbeat of your building and what is the most likely outcome if it all continues to be the way it is now. We have mold and pathogen risk detection, one of the most favorite features that our clients are very fond of. We help, again, through the help of modeling to predict at what point in the life cycle your room is of high risk for those pathogens and risks and modes. We have the health the health impact assessment, which is a very good tool for your office environment, where we tell you how the humans are interacting with that environment, with that ambient. I mean, is this causing them tired, for example? Is this causing them not at peak performance? And how can you improve to do that? So we have that collective and that research and that data that identifies a risk, and then it gives you with the insights and with the actual what you could do to mitigate that. So this is one of our reports. I mean, we just picked a few to demonstrate. Like I mentioned, we were monitoring the HISA conference, and you can see the viral risk was at that point. They were all in a low margin, although when we were having the breakfast or the lunch yesterday, you could see spikes going all over the show. You can also see the overall air quality and the bacterial risk reports that tells you if you had any high risk period, and if there were, you'd be able to drill down and see at what point that risk exceeded and what could you have done to have avoided that. So the whole idea behind Senses Air is to just making the air visible, is to giving you the control over the very thing that you do when you were born, and is the last thing that you would do when you die. So we feel that we deserve to know what that is. And at the heart of Senses Air, that is what we do. But what is the future of African healthcare systems? I mean, from a Senses Air point of view, what we believe to be the future of African healthcare systems. I think my previous speakers, they did a great job of doing that. And I would never do better than them. But from a Senses Air point of view, what if healing begins with air? What if every ward could breathe with awareness? What if the data didn't inform, but what if they protected? And above all, what if care began with the air itself? Because for us, the future of healthcare system begins with the air we breathe. That's where the core and the heart of recovery is. Now, if I could go back to my childhood hero, not the Pelé, not the Zicos, but if I went back to Lord Kelvin, and then I could tell him that now when it comes to air, we can measure it, we can understand it, and we can act on it together. And I think this is a powerful reality. What Senses Air wants to do, and I think our focus in this conference is to bring awareness that we cannot forget about the quality of the air that we breathe. I think the fact that it is invisible, it doesn't make it harmless. And every single day, we are put with the choice of which bottle of water we will drink. And our decision of picking the right water will depend on how visible the quality of that water is. And the outcome is known. Thank you.